I guess. Am I in the right place? Okay. I guess I'll start exactly at 1. Hello. Well, it is 1 o'clock. Good afternoon, everyone. Thank you for joining my panel. All the panels look pretty good today. Um, I'm Yolo Spinks, but you can call me Yolo. My presentation today is mobilizing healthy churches, how Black churches can be effective catalysts in the healthcare system. Oftentimes, when we think about many of the injustices that happen, especially in healthcare, we really don't talk about the church's role in it or what the churches can do. And that's what I really want to talk about today. So, during my presentation today, what I will cover is why it is imperative that Black churches step up and equip their people, how an effective health ministry will benefit Black churches and the Black community, and the components of an effective health ministry. And if you have any questions, feel free to drop them in the chat. I will check them periodically because I haven't figured out how to see my screen and the chat too. So if you have any questions, feel free to drop them in the chat and I will check them periodically. And I'm going to try to move through it so I can leave about 15 minutes for you all to ask any questions or give any feedback. So first, I'll tell you a little bit about myself. As I said, I'm Yolo Spinks, but my friends call me Yolo. Professionally, I'm a business and digital marketing strategist who works with Black women entrepreneurs to build their businesses and create successful strategies to market their services and products. I've been in the industry since about 2009. I started off as a blogger and social media influencer, and I work with brands like Walgreens, Home Depot, Walmart, Lexus. However, while doing all of these things, I'm a public health advocate and the founder of For Every Black Body, a nonprofit organization that advocates for the just and humane treatment of Black bodies, especially as it relates to healthcare and reproductive justice for Black women, girls, and infants. My work thus far as a public health advocate has afforded me the opportunity to work with the Office of Minority Health, the Tennessee Department of Health, to serve 2 years as an AmeriCorps member, and to be featured in a documentary, Crisis in the Crib, that talks about infant mortality in the Black communities and produced by Tanya Lewis-Lee. But enough about me. Let's talk about what does the Black church have to do with this. Basically, their role in improving the current state of healthcare in this country as it relates to how Black bodies are being handled. And also the iniquities and the inequalities that are happening in the healthcare system. First, I'll start with social movements. Black churches have historically been on the front lines of social movements in this country. Whether we were battling Jim Crow laws with sit-ins, whether we were fighting for equal rights to vote, speaking out against police brutality, the church has in some form or another been very present in making sure that Black people have access to equal rights, that we are treated fairly and humanely. Like, this is nothing new for us. And the thing that I like to add oftentimes is, when you hear people talk about history, one of the things that they bring up is Nat Turner's rebellion. Well, even Nat Turner was influenced by Christianity. So the church has always had an active role in seeking justice, not being oppressed. So so like many of you, I'm pretty sure that there's a Black church on almost every corner in your community. I know that when I ride around my city, it's one on every corner. But in spite of churches being on every corner, in spite of Black women historically being the front runners as it relates to Christianity and being in the church and building Black churches and promoting Black churches, serving in Black churches, Black women are 2 to 3 times more likely to die after childbirth than white women. Black infants are 2.3 times more likely to die before their first birthday than white babies. And Black Americans are more likely to die from colon cancer, colorectal cancer, and in spite of it being one of the most preventable cancers that exist, yet our mortality rates are still this high. And so it often leads to the question, why? But also, I know that many people argue that this isn't really a Black church issue. This has to do with Black folks and how we operate on an individual basis. However, I beg to differ. So for me, it's kind of like, you mean to tell me that when election time comes, we can invite these politicians into our pulpits, into our churches, so that they can solicit our votes, because they know that our votes are valuable. When we want to get something done, especially with Black women in the lead, we're going to get it done. So we can invite these politicians, as I like to say, politricians, into our churches and our pulpits to solicit our votes. But we can't, in return, work with them or hold them accountable to make sure that our communities are being treated humanely and justly, but we can keep parading them in our pulpits. Like, that doesn't make sense to me. And I'm going to check the chat right quick just to make sure. Okay. I told you I hadn't figured out how to do both of them at the same time, but yeah, charge to my head, not my heart. So yeah, so we can parade these politicians into our pulpits, but we can't talk to them about legislation and policy to change these systems and these processes that are in place that continually oppress our people, especially as it comes to healthcare. Like, we can't cape for Black women the way that Black women cape for churches. Like, that just doesn't make sense to me. And I refuse to be one of the people that allows this to not be spoken on. So let me backtrack for a minute. So while I was studying for my undergraduate degree, it was around 2007, I started to come across various news articles that identify my city, Memphis, as one of the, basically we were identified really as like the top city in the United States for infant mortality rates. And again, that's for any infant that dies before their first birthday, whether it was from um, low birth weight, whether it was from SIDS, or maybe just complications after birth, being born prematurely. Like there were just various reasons, but we were ranked number one in the country. And then to add insult to injury, we were also deemed certain zip codes within the city were said to have infant mortality rates as high as some third world countries. And for America to, parade around as if we are the best country in the world and we're the richest country in the world, yet we have Black babies dying on our watch at this rate. Like that was problematic for me. And for me, it was about either reading the headlines and just going along with the okie doke saying, oh, I'm so sorry that happened, because it's easy to do that when it's not your baby. When you don't have to bury your baby, it's okay to just walk away and just see it as another headline. But for me, it came down to either I'm going to be a part of the solution or I'm going to be a part of the problem. And to be idle in this fight, to not speak up about it, to not advocate for Black women and Black babies, for me, that meant that I was just going along with the okie doke instead of standing up for what I knew to be right. So, and again, they hit hard, and just seeing the statistics. And so this headline right here really caught me. I actually saw this one last year and I actually saved it. Black newborns more likely to die when looked after by white doctors. And this headline on CNN, one, we're not discussing it, and I know that we have other issues going on. Breonna Taylor, George Floyd. Like there are just so many things happening at one time. But one thing that I do know, we can't walk and chew gum at the same time. And for a headline like this to be posted in national news, international news, because CNN is an international publication, for a headline for this to be published and we're not talking about it. Politicians are not talking about it, whether they be local or federal, and you're parading these politicians in your pulpit, but they are doing nothing to change these numbers. That's problematic for me. And the one thing that I realized during this time is the system works just fine. Why? Because not everyone is dying. And so realistically, we can all say, that, well, white people do die, Hispanic people do die, Asian people do die. You know what they do, but they don't die at the rate that Black people are dying from things, even with breast cancer. Even though oftentimes Black women, breast cancer is found to be far along in the stages than it is for white women. Like our mortality rates is often related to the healthcare we receive. Black men and breast cancer, or breast cancer in men, period. White men and Black men can be diagnosed around the same time, early in their diagnosis of having breast cancer, which is rare in men. So just being diagnosed is kind of probably hard because most men don't do breast check. But even when white men and Black men were found to be diagnosed around the same early stages, Black men were more likely to die from breast cancer than these white men. There's a continual pattern. Like it's a pattern. And like, I know I'm not the only one who sees it. So for me, I just decided, I feel like if the healthcare system is broken, all communities will have these high mortality rates, but it's just us, the Blacks and the Browns, not even poor white people. are seeing mortality rates, especially with their white babies, as high as Black Americans are. And I bring that up because oftentimes when it relates to infant mortality, especially in any health concern, we like to talk about the uninsured, the underinsured. Well, guess what? These poor white people in the same position, and yet they're not losing their babies at the rates that we are. Their white moms are not dying during and as a result of childbirth like Black moms are. So this has nothing to do with socioeconomic status. This has a lot to do with a system that is continually treating us inhumanely and unjustly. And it's just time to be real about that. And for me, that's why I'm calling the Black church out. We have allowed this miscarriage of justice to go on far too long. Like, it's just time to deal with it. And in the past, I've talked to yesterday pastors and church leaders about this. And one thing that was brought to my attention was the fear of losing their 501c3 status with the federal government, with the Internal Revenue, as it relates to participating in politics. And if you're not familiar with 501c3 and politics, typically what it says is you can't endorse a candidate for office or basically do lobbying and things of that sort. However, so the way that churches get around it is if they invite a politician into the pulpit, they have to also extend that invitation out to the competition. And most of the times they don't. They leave it up to the opposite candidate to ask to be invited to the church. But that's how they get around it. Like, our doors are open, whether you're whatever party you're with. So that's kind of how they get around it when it comes time for elections. But for me, it just came down for me. I say, is it fear, cowardice, or indifference? Like, do you just not care? And while I was baffled by hearing this about the 501c3, I feel like if it's okay to solicit votes in the pulpit, if your greatest concern is losing your 501c3, then you need to relinquish your position anyway, because clearly you're not for the people. Church is about people. Black churches is about people, and not just the people who are in your congregation, but people who are in your community as well. So if you're not for the people, then you need to reconsider why you're in this. Are you really attempting to be fisherman of men? Like, are you really here for the Great Commission? Because with Black women and babies and just Black folks dying at this rate in the healthcare system, and we're not addressing it, like, that's problematic for me. And I will also say, if the Dr. Reverend Martin Luther King didn't lose the 501c3 or Ebenezer Church, honey, you safe. You ain't shaking tables like that, okay? Like, he was in everybody's face. He was all on the news as a pastor. He was in the pulpit speaking out against injustice. Whether it was Vietnam, whether it was voting, whether it was Jim Crow, whatever it was, he addressed it in spite of. And, like we all know, everybody loves Dr. King now. But back then, either other Black preachers who in the Baptist convention, who were supposed to be his friends and his comrades, they ain't even like him then. But now, we all love him. So let's just be real about what's happening here. So now I want to get into, I think the first step in rectifying this problem is for many churches is, especially in the day of COVID, is to create an effective health ministry. And I want to go through the steps of building an effective health ministry, because we can have all kinds of ministries, but it's also important that we also ask ourselves, is the ministry effective? Is it meeting the goals that we set out for it to meet? And I'm going to quickly check the chat. Okay. Hey, Amanda. So, while initially it may seem like a lot of work, and sometimes it may seem like an inconvenience, because oftentimes we feel like these are things that people can find out for themselves, they can do for themselves, but that's not always the best answer. And I'll talk about an experience that I had before I start talking about how to create an effective health ministry. When I was a AmeriCorps member, I worked with a local organization, and I focused on infant mortality. and I trained to be a parent educator. And as a parent educator, I did home visits. And I went into the homes of Black women who were pregnant or who had recently delivered. And I would go through, what they need to do for healthy eating, talk to them about making sure they meet their doctor's appointments, helping them with the kids, focusing on various ages and stages of what the kids should be doing. And if they're not doing these things, we want to make sure you bring it up to the pediatrician. Are you meeting their appointments? Are they getting their shots? So, basically just kind of helping them navigate. So one of the things that I found out during this time was that I had some clients, some Black women, younger women, and a few of them were not going to their prenatal visits. So I'm nosy. Girl, why you not going to your healthcare visit? Like what? Like what's going on? You don't have a ride? Like I'll come take you. So the thing that I found out was many of these women were poor and they were on state Medicaid. So ours here in Tennessee is called TennCare. And many of the times what happens is many doctors don't take TennCare because there is a cap on how much can be paid for a service. So then they're stuck going to some certain doctors. And what would happen when they would go to these doctor visits? So it would be doctors who probably would typically only take Medicare or Medicaid, Medicare. And so they would go and they will talk about how the doctors treated them, how the doctors mishandled them. And when we talk about healthcare, we always talk about Tuskegee and Henrietta Lacks. But it's not about how we were handled. It's about how we're still being handled, okay? So they will go to the doctor. The doctors will treat them unprofessionally, unkindly. And then they would turn around and the healthcare staff would treat them unprofessionally and unkindly. And then they will be expected to go see this doctor every month who had no vested interest in the health of them or their children. And then I decided to go with one of my clients to the doctor. And so I just watched it. So it was just like this waiting room full of people. They don't have childcare, some of them, so they have to bring their kids with them. There's no eating and drinking in the waiting room. So now kids crying because they hungry, they want some Cheerios, they want something to drink. And moms who are pregnant, a lot of them visibly pregnant, 7, 8, 9 months, and you have this baby sitting on your bladder, and if they call your name during the time when you've gotten up to go to the bathroom, when you get back, they're going to tell you, oh, you missed your turn, you have to make another appointment. And I was just looking like, this is so inhumane. Like, what is this? They would never treat white women like this. Never. So the fact that these women, the story was Black women are not going to their prenatal doctors because they don't care about themselves and their babies. But the truth of the matter is, when I come to you for healthcare service, you are mishandling me. You are mistreating me. You are being unkind to me. So for me, creating a health ministry is also about advocacy, which I will include in this. So for me, this is why I'm so passionate about it, because like I'm caping for Black bodies all day, every day of the week. Like, you're not mistreating Black people on my watch. This is not what we're doing, okay? So I will start with creating a health ministry. First, you need to build your team. Consistent of building your team, you want to recruit from within first. You want to tap your members who may be already healthcare professionals, whether it's nurses, doctors, people who understand the ins and outs of healthcare, so that they can help you build a ministry that is effective, that can really help you reach your ministries, your parishioners. That's the word I'm looking for, right? So then you want to identify your key players on the team. So who are going to be your admin people? Who are going to be the people who are going to be your programming? Who are going to be your people that are going to facilitate your workshops, or who are going to be the key people that you consult with when you have maybe you may have a parishioner who's having an issue, a mental health issue, and who are you going to reach out to? For instance, in my church, we have a counselor. Like, while it's focused on spiritual counseling, it also can cover other areas because she's a professional nurse practitioner. So we're able to have these conversations with her. Create a working framework. What do you want your health ministry to look like? So create that framework, like identify your goals, like why are you doing it? What are your create you 3 goals and determine what's most important. Like, is it outreach? Is it education? Is it just awareness? Do you want the people to have a place where they can come for their health needs, to get advice? Like, identify what your framework is going to look like and identify your goals. And then also determine your roles and your duties. Who are going to be what? And that's also a part of being your key players. But your roles and duties, this is where everybody knows what they're supposed to be doing, so that oftentimes in Black church, we be like, oh, I'm supposed to do such and such. That ain't even her job. Like, this is a time for you to detail what those roles are and what is expected of people, so that if they volunteer, they're able to meet their commitments. And one of the things that I want to bring up with this is this: don't start no cliques with the health ministry, okay? Because we have that bad as a people. Like, this is not about cliques and who you like and who you don't like. This is about ministering to and helping God's people, period. So be intentional about creating your health ministry so that it can be effective. And that's why I use the word effective often, because all too often we create things and they're not effective. They don't do what they're supposed to do. And make sure your pastors are involved. And I say this all the time, and especially in the day of COVID. So many people have fallen off from church because, we just tired of Zooms. We tired of watching church online. We tired of listening to it, like, in the car. Like, we just tired of it. So make sure your pastors are front row and involved, because even though it's about Jesus, pastors are who draw the people in, and their involvement is important. They should be attending the webinars and the workshops. They should be showing that they are 100% on board, because if the people see them lackluster about it, if they see you as a leader of the church lackluster, and it's just kind of, whichever way the wind blows is fine with you, then guess what? They're going to be the same way. And then it's going to be like, oh, people weren't interested, but it's not that they were not interested. They were just as interested as the pastors were. So be intentional about bringing your leadership team on board. Next, create a health survey. Ask about pre-existing conditions, health concerns, and topics that you want to know. I like to say in this one, assume nothing, include everything. Try to, again, get with the health professionals in your church and try to include as many conditions as possible, but also leave space for people to write things in. You want to know what's going on with your members. Also, make it anonymous. I say this all the time. Y'all know we Black. We don't like folks in our business, okay? So make it anonymous so people don't have to write their name on it. You could do like a digital survey, like on SurveyMonkey. You can get some printed out for the church and people can drop it in a box. And again, nobody knows whose survey it is. And also, they'll just, people talk at church. They be gossiping too. So it keeps people out of other people's business. Also, I want to say be inclusive. Like, include sexual health, mental health, drug abuse. Like, you may get your surveys back and you may see that you have a lot of people who are dealing with drug abuse, alcohol abuse. Those are topics that you need to cover. Maybe your church needs to start an AA program, okay? So be inclusive. And in my workshops that I do professionally for digital marketing, I like to always tell people, it does not care about what you like. We don't care about what you like and what you don't like and who you like and who you don't like. This right here is not about you. The health ministry is not about you. It's for the people of God, even the ones that are outside your church doors. So if they're dealing with sexual health and mental health issues or drug abuse or alcohol abuse, it ain't your business, because most of the time what it really boils down to is God did not put us here to be the sin police. He put us here to love one another, and we need to let the Holy Spirit do the heavy lifting and tend to issues that people are dealing with, but we need to put ourselves in a position to assist them with what it is that they need. If that's what we're really here for, we need to do the work. Next, you're going to create programming. Determine what topics you want to cover over the calendar year. So typically you start this process with the editorial calendar. Your editorial calendar is typically like when you film magazines. Every January they say new me, new year. February is always about Valentine's Day, heart health. March, is typically about St. Patrick's Day, being lucky. It's always something. But you create your editorial calendar around things. And you also can Google health calendars or health awareness days. And the government, I think the CDC and the National Institute of Health usually has one. It's easily found with a Google search. And then you're going to create your content calendar. So with this, it may be once you determine, just say February, you're going to deal with heart health since that's heart awareness month, and go red for Women Day. So that way you know what you're going to cover, and then you create your content calendar and you start putting in dates, and you can start saying, okay, we're going to meet on the third Saturday of every month. So therefore, once you determine you focusing on health that month, you can start putting a reach out for cardiologists. You can start you can ask the American Heart Association if they have someone who can come and speak to your organization. Be consistent and meet at least once a month. Again, if you are not consistent, if you lackluster about it, if the pastor, the leadership team is lackluster about it, the people are going to be lackluster about it. You need to meet at least once a month, because it really boils down to out of sight, out of mind. People have a lot going on, especially right now while we're in the midst of a pandemic. So make sure that you're meeting consistently, and even when you're not meeting, make sure you're putting out information in your bulletins. Like a lot of churches have digital bulletins right now. You sending out newsletters. Include some health tips or some health resources. Use digital platforms to hold events. We all zoomed out, y'all, but people are still jumping on the webinars. People still want the information. So even if you're not holding them in person, do digital events, record them, send them out to the members afterwards. You should have a mailing list for your church. You shouldn't just be waiting on them to come to church on Sundays to be in contact with them. You should have some other resources going, whether it's a text messaging, whether it's a newsletter, whether it's a membership database. You should know how to contact your members. And invite the community. Don't make this just about your church, but include your church. But you want to invite the community, because I often like to say your church is not going to be any greater than the community that is within. And all too often we've gotten to the point to where we have churches in certain areas, and then we drive 30 to 40 minutes and go back home, and we think that that's the end of our ministry. But if you have a church in the midst of a community and you're not doing anything to build that community, you need to move your church. Like, if you can't help the community, you need to move your church. Because again, you are there to make the community better, just not to own or rent a building in somebody's neighborhood and not do anything. We really have to get back to a mind of service, a mind of serving people, of caring for people, of loving people. So reach out to the community and invite them, because again, your church is only going to be as prosperous as the community that it is within. Next, reach out to your local health agencies, whether that is like private organizations, like your health companies like Cigna, like they do a lot of sponsoring of events. You have your state organizations, like for me, Tennessee Department of Health, I'm on the task force. Federal, we have the Office of Minority Health, the Centers for Disease Control, your local health departments. Get them involved, like know who they are, make sure they know who you are, introduce yourself, your church, tell them your goals, and ask about opportunities to collaborate, so that when you're creating your calendars and you're creating programming, you will already have people in your network that you can reach out to. And one thing that I want to say about this is, do not feel a way about requesting people who look like you. Reach out to Black cardiologists. There's the Association of Black Cardiologists. Reach out to the Association of Black Gynecologists if you don't have anyone in your church, unless you have a multiracial church or something. But when it comes down to healthcare, oftentimes, well, anything, like attracts like. So attempt to get people who your people are going to feel comfortable with. Like, we already have this issue of not addressing things in healthcare because it's people who don't look like us, don't sound like us, they're not culturally like to us, they don't even attempt to get to know us culturally or on a personal level. So attempt to get someone who your congregation is going to feel comfortable with, and really ask questions and participate. Also, when it comes to these organizations, ask them about the grants to promote your ministry in the church and in the community. Because remember, your church is no better than the community that is within. If you're not doing things for the community, like, you need to move your church, okay? Teach advocacy. So this is the most important part of creating a health ministry for me, the advocacy piece. And we don't talk about it enough, okay? Invite the healthcare professionals and organizations to speak at your events. Like I said, you have the Association of Black Cardiologists, the Gynecology Association. Like, get these professionals in the door, but don't just get them in the door. I want you to do something particular with this. I want you to cover real topics. Like, get these healthcare professionals who know the bureaucracy of the system and get them to talk to your parishioners about what the Patient Bill of Rights is, what HIPAA really is and what it means, and how to properly file grievances. Oftentimes, many of these issues that we're dealing with, high mortality rates and inequalities and iniquities in the healthcare system, is because we don't know the proper ways of filing grievances. Whether you be in a hospital setting or a doctor setting, because let me tell you something. If enough people send in written complaints on a doctor to the medical board of the state that doctor is operating, when it comes time for that doctor to come up for relicensing, it's not going to be a smooth, he pay his fees or she pay her fees and they get a new license. No, it's going to come down to, oh, doc, we got about 75 written complaints on you. We need you to come in so we can talk about this. We may need you to take some classes, or we may need to suspend your license. See, when you create a paper trail, and enough people start to create paper trails, we got to teach our people how to create paper trails and not just talk about it amongst each other, or just decide that I'm not going to go to my appointment or I'm not going to go to that doctor anymore. We got to start creating paper trails to let people know that we're serious. And if we learn to do it collectively and in unison, what's going to happen is when you start touching people's pockets, they're going to treat you appropriately, because people don't like to lose money, okay? Period. So we have to teach advocacy in our churches, and get down to these real topics. It's not okay that there are certain members who understand these things and certain members who don't understand them. And because I understand, I don't care whether you understand them or not. Like, we have to collectively as a church start to equip our people with advocacy, to use their voices, to know that they have a voice and know the power of their voices. And not just when it comes down to election time and you want to parade your little friends in the pulpit, okay? So we got to be intentional about this. And also talk about firing doctors and choosing doctors that holistically address your needs. Let's have these conversations about the process of how you choose another doctor on your plan, whether you have private insurance or Medicaid or Medicare. What's the process that you go through? Because some people keep going to the same doctor or not going to the doctor at all because they don't click with the doctor or the doctor mishandling them, and they just don't go to the doctor. So by the time they do go to the doctor, oh, they got stage 4 cancer. When all of this could have been fixed if you had known the proper channels for choosing another doctor, or having the courage, or someone letting you know it's okay for you to fire a doctor and choose another one, because the doctor works for you. You don't work for them. You tell them what to do. If a doctor does not do what you need them to do, go get another one. Just like you would do with a spouse, or, not with a spouse, but somebody you was dating. If they ain't act right about it, you just go get another one, okay? Like, you do the same thing with doctors. They don't act right, bye. God bless you. And we really have to teach this advocacy piece in our healthcare ministries. Last, I want to say, create a resources hub. Gather information from all these sources that you're connecting with, sources within the church, these organizations, about mammograms, free mammograms. They have buses they'll bring out to your church, free HIV testing. They have portable testing that they'll bring out to your church. Charity programs in hospitals. I really want us to focus on this. What many people don't know, when it comes to healthcare, especially now during COVID, one of the things that sends people into bankruptcy is healthcare bills. Many hospitals, almost all hospitals, especially if they're a nonprofit hospital, they have a charity program. And what the charity program is, if I get sick and I don't have health insurance and I need to go to the emergency room, I'm going to the emergency room. Why? Because when they send me a bill, when they say, "Do you have insurance?" No, I don't. Can you pay anything on this visit today? Nope, I can't. And when you send me the bill, I pick up the phone and I call the number and say, "I need some assistance paying this bill because I don't have insurance right now, or I may be unemployed right now, or I may be underemployed right now, or I may be underinsured." Call the hospital and ask them for assistance. It's as simple as that. And I've done it before. I've been uninsured before. I've gotten sick before, and it was a medical emergency, and I had to go to the emergency room. And when I got the bill, like, "I'm not working right now." And you know what they said? "Okay, Miss Spinks, we zeroed out your balance. Have a good day." It's as simple as that. Your healthcare, your church members need to know that if you're sick, there are resources available for you, and we need to be a part of getting those messages out to them. Don't just sit at home about to die because you feel like, "I don't have any insurance right now because I lost my job and I don't have insurance and I'm sick," and you on your deathbed sitting at home because you feel like you have no other recourse. No, go to the emergency room. And "I don't have insurance. I ain't working right now." And when they send you the bill, "I need some assistance on this bill." And most of the time, if you're not working, especially so many people lost their jobs due to COVID, lost their insurance, a lot of times they'll zero it out. So don't let your members walk around sick and feel like there are no resources available. Do the work. Allow your health ministry, your team members, to do the work to get these resources to the people, so that even if you're not working, you don't miss a mammogram. Making sure that their kids are getting their shots that they need to get done. Just making sure that we provide the resources. It's not enough for us to know the resources and not sharing with anybody else. And also, again, send out health tips in your newsletters and your bulletins, to just kind of keep people abreast of what's happening. And yeah, I think that's about it. So lastly, I just want to say is the importance of creating a health ministry, and especially the advocacy piece. If you get people on board with individually being able to advocate for themselves, then what it does is it makes them more courageous, where they can come together as a group. And then you start to have all these Black people everywhere, in different congregations all throughout the country, starting to get on one accord about advocating for themselves, advocating for their Black bodies, their Black babies, their Black husbands, their Black wives. And then everybody comes together, and then we can create a social movement that focuses around creating healthcare industries and organizations that understand that they're going to have to stop treating us the way that they are, because again, the system is not broken. Because if it were broken, it would be broken for everybody, not just Black bodies, but for white bodies, Hispanic bodies, Asian bodies. So it's working for who they want it to work for. And it's time that we create individuals who are courageous enough to step into the power that we have to say, we're not going to deal with this anymore, so that we can collectively come together and create social movements and impact change, that's lasting change, so that 10, 15, 20, 30 years from now, our kids are not still dealing with this same foolishness. So yeah, that's it for me. So I just want people to advocate for themselves, advocate for your families. I want churches to teach advocacy, especially in healthcare. And it'll fall over into every other area in your life, your personal life, creating boundaries on your job, letting them know that, "No, you're not gonna treat me like this. I might need a check, but you're not gonna treat me like this." To start teaching our parishioners advocacy so they can stand up for themselves. So that is it for me. Let me check and I'll leave. Okay, hold on. Here it is. I'm going to check the chat. Thank you all for attending. I know that many people are watching on the replay. Thank you for coming, Amanda. Hi, Robin. So yeah, I don't see any questions. But yeah, so that's the gist of it. So I guess I'll see. Does anyone have any questions? I know a lot of people will watch on replay. Thank you, Robin. Thank you so much. I enjoy doing it. And yeah, it's about being courageous. A lot of things, just because we haven't tapped into our courage, and oftentimes in scripture it says be of good courage, and that's what we have to do when we're dealing with issues such as this, and we can't be afraid of what we're gonna lose. Like sometimes you gotta lose stuff to gain stuff, and you gotta be okay with that. So yeah, thank you so much, and let me stop the screen share. Okay. Yeah. So you all have 15, what I gave you, what 18 minutes back of your time. So you can have your break before the next session start. Thank you, LaKesha, for inviting me. I really enjoyed it, and you have my information from the last slide. Feel free to reach out to me if you have any questions or if you want to follow up about anything. Bye. Do I just log out, LaKesha? What's she on? I think I do. Oh, you're so welcome, Miss Lucille. Hmm. I'm gonna assume so. So you all have a good rest of your day. I'm gonna log out. I think that's what I'm supposed to do. Oh, my email. I'll put it in the chat for you, Miss Lucille. SBA. I put it in the chat so you can grab it from there. I'll be looking forward to it. Thank you so much. Well, that's it, you guys. Thank you again. There's also a feedback form at the top for the event, um, about recommending the event to your friends. Make sure you fill it out so LaKesha is able to basically just assess how you guys like it, and make any necessary changes if she needs to. Bye, y'all.